Endometriosis is a chronic disease where endometrial tissue, which usually lines the uterus, grows outside of the uterus. It is characterized by elevated pro-inflammatory cytokines in the peritoneal fluid. Endometriosis affects people of reproductive age, including women with a uterus, transgender men with a uterus, and non-binary people with a uterus. Normally, in the uterus, the endometrial lining builds up every month in response to cues from hormones. This prepares it for possible implantation of a fertilized egg. If there is no implantation, the endometrial lining sheds and leaves the uterus through the cervix and vagina in the form of menstrual blood. Most often, endometriotic tissue grows in the pelvic cavity, adhered to the bowel, ovaries, bladder, and outside of the uterus, but endometriosis has also been found in other locations in the body, like the lungs. Endometriotic tissue can proliferate in several ways. Often, it looks similar to endometrial tissue in the uterus. It has glands that are secretory and change with the menstrual cycle, and it has stroma that are highly vascularized. Endometriotic tissue, however, can also be fibrous and contain cysts. Ovarian cysts caused by endometriosis are called endometriomas. Endometriomas are often filled with blood and sometimes called chocolate cysts. Endometriosis affects 10% of reproductive-aged people with a uterus. A large factor that causes the delay of diagnosis is a lack of non-invasive ways of diagnosing. Also, many people do not have symptoms or symptoms are overlapping with other issues. The most common symptoms are dysmenorrhea and subfertility. However, despite decades of research, the etiology of endometriosis remains a mystery. There are three main theories about the etiology of endometriosis. The first theory is called Sampson's theory of retrograde menstruation. When a person normally menstruates, endometrial tissue leaves the body through the cervix and the vagina. During retrograde menstruation, some of the blood and endometrial tissue travels in a retrograde fashion up the fallopian tubes, where it leaks out into the peritoneal cavity and forms endometrial lesions. This theory has been questioned because up to 90% of people without endometriosis also experience retrograde menstruation, and only 10% of people with a uterus are diagnosed with endometriosis. The second theory is called coelomic metaplasia theory. Many cells in the reproductive organs in the pelvic area originate as the same type of cell, called coelomic wall epithelium. The coelomic metaplasia theory posits that hormonal changes, environmental stimuli, and infection cause cells outside the uterus, say on the ovaries, bowel, bladder, or lungs, to transform into endometriotic cells through a process called metaplasia. The theory helps to explain why endometriosis can develop in areas outside of the pelvis, including the lungs. However, metaplasia usually increases with age, and endometriosis tends to rapidly decline in menopause. The last theory is the stem cell theory. This theory posits that stem cells from the basalis layer of the endometrium travel, either by retrograde menstruation, lymphatic, or vascular dissemination, into the peritoneal cavity, where they become endometriotic lesions. This theory makes sense because stem cells can easily transform into multiple cell types. Some research has found that cells in the basalis layer are shed at a higher rate in patients with endometriosis. One of the hallmarks of endometriosis is pain and inflammation, which we know is regulated by cytokines. Studies have been done comparing people with endometriosis to people without endometriosis to show certain patterns of increased cytokines of those with the disease. These are all pro-inflammatory cytokines that are found in higher numbers in the peritoneal fluid of people with endometriosis. We are going to focus on just 5 today in more depth. Pro-inflammatory cytokine interleukin-1 is one of the most predominantly circulating factors in endometriosis. Interleukin-1 has many pro-inflammatory actions, including stimulating T lymphocytes and eosinophils, both immune cells. Interleukin-8 is found to be increased in both peritoneal fluid and blood serum in people with endometriosis, and the more increased it is, the more severe endometriosis is. Interleukin 8 is involved in summoning immune cells like neutrophils and causing inflammation. It also acts locally as an autocrine factor, supporting maintenance of endometrial tissue. Interleukin 17 is a pro-inflammatory cytokine that is also found in rheumatoid arthritis and other chronic pain diseases. It also promotes angiogenesis, which is the development of new blood vessels from pre-existing ones. IL-17 is present in the stroma of endometrial lesions. When the endometrial lesion is removed surgically, there is a decrease in plasma level of IL-17. Tumor necrosis factor alpha, or TNF-alpha, is higher in people with advanced stages of endometriosis. There is a positive correlation between the amount of plasma TNF-alpha and the size of the endometrial lesion. TNF-alpha helps activate the immune system, promotes endometrial cell proliferation, endometrial adhesion, and angiogenesis. Vascular endothelial growth factor, or VEGF, is one of the main factors promoting angiogenesis, in addition to having many other influences in endometriosis. Levels of VEGF expression are correlated with the activity of endometriotic lesions and also with the state and severity of the disease. The higher levels of VEGF, the more severe endometriosis is. When endometriotic tissue travels via retrograde menstruation into the peritoneal cavity, it is initially without blood supply and the environment is hypoxic. HIF-alpha is released and acts as a transcription factor in cells, stimulating the transcription and translation of VEGF. VEGF acts on the body to promote angiogenesis, providing blood and oxygen supply to support new endometriotic tissue. While we know that endometriosis is characterized by the inflammatory response, it is thought that inflammation is a symptom of the disease rather than the cause. While it doesn't help us understand the genesis, it opens many pathways to potential treatments targeted at these symptoms to provide relief. Even with all these potential theories, the cause of endometriosis is mostly unknown.